Hi everyone, welcome to our Hangout. I am delighted to be hosting this session today. My name is Areti Manataki. I'm the course organizer for the Data Science in Stratified Healthcare and Precision Medicine course on Coursera. It's been running for about just over 2 years. And we're always very, very excited to meet our students and get the chance to discuss topics that are of interest to us and to them. The plan was for the teaching assistant, Minghong Wang, to join me today. And we were just setting up 15 minutes ago. Minghong is currently based in China, and I think she might be having some issues, technical issues, with regards to joining us. I know that she's still trying to join, so you might get to see her later on. I'm keeping my fingers crossed, but we'll have to wait and see. So, what is a Hangout session? What are these meant to do? And what is supposed to why do we have them, really? So a Hangout is an informal session where the teaching team and students can come together in an informal setting and talk about topics in the course, questions that you may have, and anything health data sciencey, really, that you might be interested in. So it's meant to complement the learning experience that you have through the course on Coursera. And as said, the plan is so we're currently recording the session, and the plan is to make it available on YouTube later on our channel, so that people that were not available to join can watch afterwards. So the way we usually approach Hangouts is we give us a short introduction and remind everyone what the course is about. Then we go through some of the questions that people have posted in the discussion forum. Talk about news and updates in the health data science world, and also hopefully we'll get to see some of your questions in the chat here, and I'm very keen I'll try my best to answer them, or to answer as many as possible during this session. So let's get started. Let me remind you what the course is about. So it's meant to be an introduction to data science in biomedicine and healthcare. And our objective is to give a broad understanding, a broad overview of computational methods involved in precision medicine and stratified healthcare. Topics that we cover include sequence processing, image analysis, machine learning, natural language processing, graph data, ethics and societal implications of data science, and others. So depending on where you currently are in the week, it's a 5-week course, you might have seen some of these already or not. I don't think it's a problem being in the same space, in the same Hangout with people that are further ahead in the course or even behind. You can still discuss about anything health data sciencey, really, in the chat. So I think I'm gonna focus a little bit more on natural language processing today. Minghong was planning to describe a few COVID-19 related research projects that she's been involved in. So if she manages to join us later on, great. Otherwise, we'll just post those news in the discussion forum in the course. So what is natural language processing, and how is it relevant and useful to the healthcare domain? Natural language processing is nothing more but a set of methods, computational methods, for analyzing, for processing free text. So we're not talking about nicely structured data where you have a table with rows and columns and you've got values in there, but rather we have the complexity and the richness of natural language, of English or French or Chinese. And there's a lot in freestyle text. There's a lot we can learn from it. So electronic health records contain a lot of useful information that is not necessarily put into your standard forms that then are converted into tables. So there's a lot of useful information that one could extract from pathology reports and referral letters and so forth. It's a challenging task computationally. So to get a machine to understand what it is that we mean humans when we speak or when we write, it's really, really hard. In the course, we talk about different kinds of natural language processing tasks, and we break them down in two different levels. We describe low-level and high-level tasks. So low-level tasks include things like sentence boundary detection, so detecting where you have a sentence and where the next one begins. Tokenization, so what are the different parts of a sentence, for example? You have words, you have punctuation marks, and so forth. Part of speech tagging, shallow parsing, morphological decomposition, and others. And then in terms of high-level tasks, in the course we talk about spelling or grammatical error identification and recovery. And we also talk about named entity recognition, as well as negation and uncertainty identification. And well, what these mean is the following. So for example, with negation, there are different ways that humans express negation when they speak. So you might say, I am not, today it is not raining, for example. This is a silly example, but I'll go with it. Or you could also say, it doesn't look like it's raining today. I'm glad it's not raining today. So for a human, it's very easy to realize that the answer to the question, is it raining? The answer is no. To a machine, it's not always that straightforward, because there are different ways you can express negation. So yes, there's a natural language processing is an area where there's been a lot of interest lately in the healthcare domain. There's recent advancements and good success stories really around the use of deep learning methods for natural language processing. So there's a lot of potential. We're not there yet, and there's a lot of effort in the research community to make progress. So we'll see where we are in 2 or 3 years' time. Currently, there are lots of challenges around processing freestyle text. So it's not standard practice, I can tell you that. I'm just keeping an eye in the chat to see if there are any more questions coming up. My plan is to answer those questions towards the end, unless it's directly relevant to what I'm talking about. So I'll try and somehow integrate things. Good. Now we're very happy to see a few questions in the discussion forums. And overall, let me just say that discussion forums are your space, basically. It's where you, the class, can come together and discuss topics in the course, help each other learn, share tips and tricks, and so forth. We are there, we moderate the forums, and we make sure when you're stuck, if no one comes in to help, so we'll answer your question. But the idea really is that it's a space for you to help each other learn. So some of the typical questions that come up in the forum are related to the programming side of the course. In the course, we use Python and the Pandas library and other libraries that help you analyze data in healthcare. So one of the questions that have come up quite a few times is Jupyter notebooks. So someone asked, well, I would like to analyze some data, so work with files that I have locally on my computer. Can I use the Jupyter notebook facility functionality in the course to do that? The answer is not really. So the way we've set up Jupyter notebooks on the Coursera servers is it's done in a way so you can read files that are directly linked to the course. So these are already created, those workspaces for you. However, there's good news, because if you do have some files that are stored locally on your machine, you can install Jupyter notebooks on your machine. So you're not really depending on Coursera IT working. So there's, if you do a web search install Jupyter Notebook, you'll be able to find lots of tutorials and videos, and you'll find the link of where and how to do that. There's typically people use the Anaconda distribution to do the installation, but you might be interested in other options as well. We were discussing this question with Ming Hong earlier, and Ming Hong had some other suggestions as well. So one option is to install Jupyter Notebooks on your machine. Another option would be to use a completely different IDE, so a different environment for working with Python. Ming Hong would like to recommend PyCharm. She's a big fan. So, and again, it's freely available. So you can web search for PyCharm. In fact, I might just type it in the chat here. And then start working on your personal projects, which I think is a great way to learn, by the way. So there was another question in the forums around careers in health data science and how one can get into that. And I can see that there's a question around that in the chat here as well. So the question in the forums, it was a question from Ileana. Ileana was asking, are there any courses, master degrees, or skills that are needed in order to develop a career path in health data science? The short answer is yes, there are plenty. So I suppose the big challenge is to find the one that works for you. So who are these people? Who are health data scientists, and where do they come from? So remember in the first week one of the course, where we had a video about demystifying data science, and we said, well, data science is nothing but more than the combination of computer science, programming, mathematics and statistics, and domain expertise, which in our case is expertise or understanding, knowledge about biomedicine and healthcare. So health data scientists typically have a background in one of those areas, and then they develop the skills needed or the knowledge needed in the rest. So it's not uncommon to have computer scientists that learn a little bit about data science and learn how to work with data, but then, to work in the healthcare domain, they need to develop an understanding of, what health data looks like, what the challenges are in working with health data, and so forth. A different journey into health data science careers is, so you might have people that are healthcare professionals or healthcare students, and then specialize in data science. So they develop practical skills on working with data. So in the University of Edinburgh, all our year 2 undergraduate medical students have been taking a data science in medicine course, which is actually quite unique. It's the first one of its kind in the UK. So our ambition is that the medics of the future will know how to work with data and harness the power of data. So that's one way to do it. Now, if you've already done your undergraduate and you're thinking about getting into this area, there are many masters, free online courses, and CPD, so continuous professional development courses available, many of which are online. So in the UK alone, there are many. I wouldn't know what the number is, but just in the University of Edinburgh, we offer, so there's an online master's in data science, technology, and innovation, where people can take courses related to healthcare. I teach a course there called medical informatics. And in fact, that course is also available as standalone. So one could decide to upskill or reskill in data science through that course. There's also another course that brand new course that I'm leading called Health Data Science, which is designed in particular for people with a healthcare background that want to reskill in data science. So it's running currently, and we expect it to run again next year, hopefully. And there are plans in the university for more training across health data science. So that includes a new master's in data science for health and social care. It includes CPD, so again, continuous professional development programs. There's something called data carpentry, where people can go and learn some data skills. So there's plenty. So I suppose this has been a rather long answer. I think what is important when choosing which program to go for is to think about what it is that you need. So what is your current profile, and what kind of a career you would like in health data science. You could be the person working with the data, or you could be a project manager. So getting these groups of these interdisciplinary teams to work together. So it's different kinds of knowledge that you need for each of those roles. There are some programs that are very technical, others that are less technical. So when looking around and considering your options, I would highly recommend that you contact the admissions teams of the corresponding masters, for example. They know a lot about their program, and they can advise you on which courses might be most appropriate for your profile and your career aspirations, let's say. So I'm just going to double check again. So Elle is asking, so are you saying it's more common for healthcare professionals to develop data skills rather than the other way around? I think that currently it's more, you see more computer scientists entering the health data science world. But I think this is, so there's definitely a bigger uptake, an increasing uptake in the last couple of years, maybe from the healthcare domain. So I wonder what it's going to be like in a few years' time. Afla is asking, what would be a good project to work on with respect to employer perspective? That's a good question. I think it really depends on the employer and the kind of jobs you're interested in. So, for example, if you want to work with data and be analyzing health data as part of your future job, then you might want to find yourself a project where you can actually show some results. And there's something called GitHub, so do look it up if you don't know much about it already. You can create an account on GitHub, share your code, and employers are, it's a place where an employer would look for projects of potential candidates. So it's a good way to sort of promote yourself as well and show the kind of work that you've been involved in. Sushil, I don't know if I'm pronouncing your name correctly, by the way. I hope I am. So Sushil is asking, so does this course connect into some other courses later on to continue learning data science? You don't have to continue to a follow-up course, but there are options. And definitely with the University of Edinburgh, there are good links with other courses. So for example, the health data science course that I mentioned earlier, it nicely complements this one in that it includes R programming skills, which are, so R is another programming language, just like Python. So it goes a little bit deeper into analyzing data using R, and it also considers, we drill a little bit further, a bit deeper around societal implications, ethics and governance. These are topics that we do discuss on week 5 of this course. But I think for your future career, I think it would be useful to know a little bit more. So that's why we included them in that course. Good. I think these are all the questions I spotted in the chat around careers. Let me see what else there is here. Oh yes, so there is a question around research studies around COVID-19. So we're currently in the middle of a worldwide pandemic. So it's not a big surprise that research teams around the world are working really hard to find solutions to the pandemic. And that includes both understanding the virus as well as preparing, looking at care pathways and getting ready, preparing for a potential next wave, or learning how to live with it. You know, what is the economic impact, societal impact, and so forth. So we had a chat about this with Ming Hong earlier, and Ming Hong recommended that we mention databases that include real-time views of what's happening with the virus. And this includes a database released by the Johns Hopkins University in the United States of America. There are lots and lots of new papers being uploaded on arXiv. So again, in case you don't know what arXiv is, I think I'll just type it in the chat. You can look it up. So arXiv is an online repository for research papers. So the way research publications work is that you prepare a manuscript, you submit it to the corresponding journal or conference, and then it goes through the peer review process, which means that experts in the field, usually from 3 to 5, will have a look and review it over its rigorousness, the importance, the significance it has on the field, potential impact, and so forth. And then it is based on the decision. It's based on these peer reviews that a decision is made on whether to accept that manuscript in that venue or not. So arXiv is something different in that sense that it is not a journal or a conference. There are no peer reviewers. It's an online manuscript repository. And there are different versions of arXiv called bioRxiv, for example, for studies in biology, or medRxiv for studies in medicine. And the reason why it's become very popular is because the peer review process, it takes a while. So if you've got some important results today and you want to publish them, it takes a while to reach the rest of the world. So some researchers choose to make their results available on arXiv first, so that teams that are working on this, including teams working on COVID-19, could get an update and learn from what you've done and then build on that. So I would highly recommend, if you're curious, do go on arXiv and have a look. One should point out that these papers are not peer reviewed. So it could be that they include mistakes. So this is something to bear in mind. It's really up to date. You get an idea of what people are working on right now. But since they have not been peer reviewed, you have to exercise your personal judgment on the rigorousness and quality of the paper. So there are a few papers on arXiv that we thought were interesting. There's one called COVID-19 Image Data Collection, Prospective Predictions of the Future, by Cohen et al. And there are a few more that we'll put up on the in the discussion forums later on. The last point I thought I would mention around COVID-19 related research is the work that HDR UK is doing. HDR UK is Health Data Research UK, so it's really UK based, and how they're championing the use of health data to respond to COVID-19. So one of the things they do is they invite people to submit, to contribute their research questions. So anyone can do that. You don't need to be based in the UK, as far as I know, or you don't need to be an expert in the particular virus. So people can contribute their research questions, and then others, teams working on related topics, could take some inspiration or respond to the questions contributed. There is also there's a tool for contributing your research projects. So one of the challenges when it comes to COVID-19 research is that many people in the world are working on similar topics. So we don't want to duplicate work. We want to make sure that we're extending and enriching the current understanding. So it's really important to be aware of other related projects and what results they have. So you're not doing the same work, basically. So HDR UK is keeping a database of research projects and what it is that they're investigating. And there's also a quite cool, I would say, matchmaker tool. So if there are research questions and teams projects, then these can be mapped. So I'll also type in the chat the HDR UK acronym, and then you can look it up. You can look it up online. And oops, that was a typo. HDR UK. There we go. Good. I would like to invite you to some more questions in the chat. I'm going to be around for another 3 or 4 minutes, if that's okay. So I can see a couple here, so I'll start with those. So Soon Ho is saying, I'm going to take I'm going to take the MSc in Data Science Technology and Innovation course in Edinburgh this September. Would you recommend some preparations before that? So so first of all, it's great to hear, Soon Ho, that you're going to be joining us. My answer will be sort of generic to anyone starting a similar master's. So I would say, depending on your background, so if you're a computer scientist and you're going to be doing health data science masters, then you might want to have a look at the list of the courses that you're going to be choosing. And if it seems like you need some extra understanding of healthcare, do have a look on Coursera, do have a look at other online learning platforms like edX or Udacity or FutureLearn, and see if there are any courses around healthcare. So I can tell you that there are. So the question is, what are you most interested in? There's another question from Sri Lakshmi, if I'm pronouncing that right. So the question is, can there be any, are there any jobs or job roles after learning data science for pharmacy students in R&D or any related sector? So this is a rapidly changing and evolving area. And I wouldn't be surprised if there are more jobs in the pharmaceutical industry compared to nowadays. So there are already data science related jobs in pharma. I think it's going to be growing a lot in the next few years. So I suppose my answer to your question is yes, I think there will be a lot of R&D related roles. I wouldn't be surprised if they were interested in people working with the data, so data analysts or data engineers, but also project managers, so people that put those teams together, especially if the projects are rather challenging, as they typically are in research and R&D, then I think you need other roles to sort of sit and complement those sort of hands-on people. So I'm going to answer one last question, and there's one from Luis here in the chat, and the question is, so Luis says, I'm a service engineer and service designer. I would like to know more about what are the organizational challenges to do research using data science in terms of processes, policies, people, culture, etc. What needs to happen in the industry to overcome those challenges? Luis, I have to say this is an excellent question, because what we are currently seeing is that, well, the technology is there. So there are really good advancements, really good developments in computational methods. Data availability we're getting there. Data quality is not always good, so that's one of the challenges. But I think at least when thinking about the UK and the NHS, there are definitely cultural changes that need to take place, processes and policies. So one of the sticky points in health data science projects and success in the NHS is that really. And I would probably direct you to go back to Aileen Keel's interview in week 1, who I think she describes this in a very good way. She's someone that is really experienced in the field, and she did identify policies and processes and people, culture, one of the main challenges. So I think this is an excellent discussion to take back to the discussion forums, if that's okay. I think we're already a bit late, so I think I will stop here. Thank you all very, very much for your participation. It was great to be able to see questions that you had and topics that you're interested in. I would invite you to post these and other similar questions in the forums, and I would invite everyone in the classroom to contribute. So if you are working in healthcare and know a little bit more about challenges, for example, around processes, policies, people, and culture, please do let us know. We can share our opinion, but the whole idea of the forums is for us to learn from each other. So yeah. Thank you very much. Thanks for your participation. Hope to see you again in another Hangout, maybe sometime in the next couple months. And hope you all keep safe and well. Goodbye.